everyone, welcome back to the channel. If you're new here, my name is Natalie. Today we're diving into a topic that could completely change the way that you talk about your health. Did you know that trauma, and particularly childhood trauma, which often results in PTSD for some folks or complex PTSD, has been scientifically tied to developing chronic illness or autoimmune illnesses later on in life? That revelation was very impactful for me personally, as someone that used to work as a therapist and ended up leaving the field due to my own chronic illness. Yes, it's true. Your childhood experiences are still impacting your health today. Those experiences may actually be more linked to your physical health than you realize. Here's the thing. Oftentimes when people hear the word trauma, they imagine something absurd that couldn't possibly relate to them. They think about like famine, they think about World War, atomic bombs, natural disaster, but they hardly ever think about emotional neglect, emotional abuse, bullying, growing up in a home where you felt rejected or emotionally abandoned, dealing with chronic health issues as a child, or even dealing with a stressful work environment for many years. When we're talking about complex trauma, that's exactly what we're talking about. Compounded traumatic incidents that occur without any sort of respite. And your body, it doesn't forget. It doesn't forget anything. In fact, there's this wonderful scientific book called The Body Keeps the Score. If you're interested in it, I recommend that you check it out. I'm sure you could find it, on Amazon or wherever you purchase your books. It's a very, very good book that goes into details about what physiologically happens to us when we experience trauma and how that trauma shows up in our physical body. Let's talk science for a minute. When we experience trauma, our body is kicked into survival mode. And what that will look like is either we want to fight, we want to run away, or we're going to freeze. All of us are going to have either one of these responses when we're experiencing something traumatic. And unfortunately, what trauma brings to our brain is a heightened level of cortisol and adrenaline. And both of these hormones are stress hormones. These hormones actually contribute to the body falling apart over time if our brain keeps getting flooded with them. When we do not take the time to heal and resolve our trauma when it's happening, as I mentioned earlier, it gets compounded over time. So we continue to experience it inside of our body as if it was continuing to happen. And that's basically the price for refusing to heal, is that we continue to re-experience the trauma in and of itself within our body for the rest of our lives. Very similar to anyone that's in a relationship that's abusive and they're there for a long time. The body basically kicks itself into this like high alert mode where it's really nervous all the time. So even when the relationship is not abusive, the body is kind of like bracing itself for when the next abusive act is going to come from, whether it's emotional abuse, verbal abuse, physical abuse. So the body struggles to regain like its state of like peacefulness, its state of like stability when it's chronically exposed to traumatic events. So that high alert state that I mentioned earlier, where hormones are basically being dumped in the body because the body is activated as survival mode, is basically ongoing. So what does that look like for us in the body? It looks like increased inflammation, which is often what brings on, chronic illness. It also looks like a weakened immune system. So those of us who are dealing with autoimmune disorders, it's related to your immune system being weakened over time. It also messes with your gut health, which again is why gut health is so imperative for healing lupus and any other autoimmune, illness and disease that you might be dealing with. And lastly, it really disrupts the hormonal system in the body. So even though the traumatic incident is not happening right now, your body constantly feels tight. Your muscles feel tense. Your psychological system is on high alert. You're waiting for when the next piece of danger is coming from. You're overanalyzing things. You're constantly in your head. You're basically like exerting a lot of energy to try to protect yourself from the trauma which has already happened. So there's no like escaping it. So in a way, it's kind of like psychologically and emotionally you're trapped, and your body is receiving that message. So then it's generating more hormones to remind you that you're not safe. Over time, that can look like heart disease, irritable bowel syndrome, diabetes, hypertension, autoimmune issues, fibromyalgia, endometriosis. The list goes on and on. Now let's go into some of the physiological effects of that destabilization that happens when our body is in a constant state of fight or flight or survival mode, fight, flight, or freeze. The first thing is our stress response. Being exposed to stressful events over a long period of time will basically put our body in a stress state. And what I mean by that is that our stress response gets dysregulated. So under normal circumstances, in the absence of trauma, when you experience something stressful, you have an appropriate response to it. As an example, you're driving on the road, somebody cuts you off on the road, there's an appropriate response for that. If your body's stress response is regulated, you respond one way to it. When your body's stress response is dysregulated, you might respond in an extreme manner. You may have heard about people who have gotten into arguments on the road with people who cut them off, and then the argument escalated to them ending up like getting physical with that person or even brandishing a weapon. These types of situations happen because our body doesn't know how to handle stress, because it's been under stress for so long that now when we experience any stress at all, it feels like the world is ending. And as a result, we respond as if the world is ending, even though in reality, this is just a minor annoyance that everybody has to deal with on the road. Number two, our immune system. Chronic disease is basically the result of our immune system being dysregulated over a long period of time. When our immune system is dysregulated, we tend to get sick more often. So we experience more infections, more inflammation, and our body constantly being exposed to inflammation and infection naturally leads to chronic illness because the body is stuck in the stage of constantly fighting off something, whether it's a virus or a bacteria. So we're constantly in this state of, again, fight, flight, or freeze. And that happens on the cellular level within the body as well as within the immune system. Metabolic diseases or disorders, including other chronic conditions like hypertension, diabetes, are all linked to trauma because these conditions are directly connected to our hormones. So when our hormones are imbalanced because we're experiencing a heightened state of being constantly, where we're in this like defensiveness, we're in this like argumentative state of being, we're in this place of like ready to fight or ready to run away to protect ourselves. Basically, we feel in this state of like warlike experience. When we talk about complex PTSD, people often assume it's about going to war, but you don't have to go to war to have complex PTSD. It's merely the result of being exposed to traumatic events, one after the next, without any respite. And the respite is where your body can rebuild itself, or it can heal itself, where it gets to like return to its normal state of functioning. But when the body doesn't get a chance to do that because difficult, challenging, or bad or harmful things are happening to an individual again and again and again, the body starts to feel like it's at war, even though it's no longer in that stressful environment. So hormonal imbalance is very, very common when we're dealing with trauma, which naturally leads to these other diseases like diabetes. And as you may have suspected, trauma has also been linked with heart disease, as well as having a stroke. So trauma not only affects our hormones, it also affects our heart and the way our heart is functioning. Because as you can imagine, when you get into a fight or flight sort of response, when you get into a situation where you feel like you have to fight somebody off or something off, or you have to run away from something or someone, your heart starts racing. I don't know if you've ever been into a fight, but that's usually one of the indicators that you're not safe, is that your heart starts racing because your body's preparing you for being able to get out of that situation safely. And when we're constantly in this state where our heart rate is heightened and where our resting heart rate isn't able to prevail, if the majority of the time our heart rate is heightened, it creates an unhealthy rhythm with our heart, which then can look like a stroke or heart disease down the line. So as you can see, a lot of physical responses that we have to trauma come from the dysregulation that happens inside our body across these various systems. And when we're continuing to experience situations that put us in that zone, our body does not get to repair. So then we are constantly living in this kind of warlike state where we're hyper vigilant, we're anxious, we're nervous, we're scared. And for some of us, we don't even have the language, depending on how we grew up, to even acknowledge that this is what we're experiencing. For many of us, we're just kind of living life on this high alert state without even recognizing why we feel that way, how long we've been feeling that way, and putting an effort to actually make things better and combat it. In the 1990s, scientists conducted a study called the Adverse Childhood Experiences Study, in short, ACE. The ACE study changed everything in the world of psychology with regards to understanding, the connection between childhood trauma and how people end up doing as a result of childhood trauma. Researchers got 17,000 people together and they asked them to report on traumatic experiences that they've had in their lives. Experiences like neglect, emotional abuse, or even witnessing violence as a child. The findings were earth-shattering. Researchers were shocked to find out that the higher your ACE score, your ACE study score, the higher the chances that you would experience certain health conditions. Okay? So if you scored high on this test, that could predict health conditions that you're most likely to experience as a result of this childhood that you've had. As you can imagine, depression, having a stroke, having cancer, having suicidal thoughts, and experiencing liver disease are related to having high ACE scores. Researchers found that people who had 4 or more ACEs score ended up being 2 to 12 times more likely to develop a chronic illness. This is why I personally don't believe that we can talk about healing without talking about trauma-informed care, without talking about trauma-focused therapies. Psychological support, getting a therapist can certainly help somebody learn how to cope with the effects of trauma. Providers and healthcare professionals who specialize in trauma are able to be attuned to symptoms of trauma. So when they're hearing about the health symptoms, they're not just hearing diabetes and stress and anxiety. They're actually hearing physiologically what's happening in your body that's causing you to have that response. Several mental health conditions, diabetes, chronic heart issues, cardiovascular disease, chronic pain, as well as autoimmune diseases have all been linked to trauma. In the case of diabetes, type 2 diabetes specifically has been linked to trauma. Depression, anxiety, and other chronic health conditions, PTSD, complex PTSD, all those conditions can only make our physical conditions much worse. Adding that layer of stress onto the physical health concerns only makes life more challenging. Chronic pain also has been linked to trauma scientifically, especially people who experience low back pain, arthritis. These two conditions specifically have been linked to trauma. So whether we're talking about fibromyalgia, or in my case lupus, or any other autoimmune condition like arthritis, I need you to know that science has already connected autoimmune conditions to trauma. Chronic lower or respiratory issues has also been linked to trauma. So for many people who were born with these conditions, I just want to get you thinking about the impact of generational trauma on our physical health. A lot of our spiritual calling, in my opinion, in this life is to heal the trauma that was passed down to us, so that we do not pass it down to the next generation. And I know that's easier said than done, but Healing is imperative because there is no human life that has never experienced trauma. So there's nobody who doesn't need healing as a result. Okay, I know all of this might sound heavy, but the important thing to remember here is that you are not broken because everyone needs to heal from something. So, in some regards, what you're going through isn't unique because the human experience in and of itself is plagued with suffering and trauma. So, the issue isn't so much a traumatic event, but more the response that we have after the traumatic event. It's important to take time to bring awareness to why the traumatic event even happened, how it affected us, and how it continues to affect us today, even though we're way past the actual incident. There are several tools out there in the field of therapy and mental health that can assist with this. I highly recommend EMDR for people who are looking to do deep trauma work. Somatic experiencing therapy is also a wonderful way to reconnect with our body in a very concrete and tangible way, because what trauma does basically is it severs us from our physical body. When we're in that fight or flight or freeze mode, we're just trying to survive. So we get into our heads very fast because we want a solution to the problem. We want it to stop, we want it to end, and we want to get away so we can live past this incident. So for many of us, after the traumatic event, we stop living in our heart space, in our heart chakra. We're just focused on thinking and overthinking and thinking and overthinking. And meanwhile, for some of us, while this is happening, we're feeling very, very big emotions that we may not have the tools to even express. So it's like this problem that gets compounded in and of itself. If you will, it's kind of like a wheel that you can never get off of. So somatic therapy allows you to get reconnected to your physical experience. Another evidence-based psychotherapy is internal family systems therapy. I really like this type of therapy because it allows you to have a deeper understanding of your family dynamics, your family patterns, and basically the patterns that were in place before you were even born that gave way to you experiencing the childhood that you experienced. It's been proven to be particularly effective for anxiety, depression, substance abuse, and anyone that may struggle with panic or phobias in general. Breath work and meditation are also excellent tools to manage the emotional dysregulation that comes from trauma. I'm a huge advocate of meditation and breath work for this reason, as it's proven to be very effective in my own life. Regular movement is also very good for the body. So whether we're talking about dancing, we're talking about yoga, Tai Chi, walking, any type of physical exercise, because again, the trauma is trapped inside the body. The more we can move our body, the more we get reconnected to it in a way that is healthy. So physical exercise in general, body movement in general is very, very good in helping us cope with trauma. Another thing that's very helpful is gut health, basically avoiding food that causes inflammation to the body. If you're living with a chronic illness like lupus or any other type of chronic illness, you know how important gut health is to your overall health. Scientists have actually done studies that show that the quality of our gut is connected to our mental health. So there is a connection between the brain and the gut. So a good way to help ourselves feel better here is to attend to what's happening in our gut. So avoiding foods that inflame the gut is a good way to reduce inflammation in the body, which then reduces hormonal responses that are unhealthy, like the fight, flight, or freeze that we talked about. If you have grown up with a lot of trauma or dealt with a lot of trauma, it's important to find community of people who understand your experience, who can affirm your experience, and really provide you with that emotional support to continue to heal and get strong and build your resilience. Obviously, it did not kill you, and I'm not necessarily saying that that makes it easier, but it means that you have the tools and the abilities to be able to survive it. And being around other people that are surviving it can make you feel stronger. This is why it's so important to be around a strong, supportive community or even a community of survivors. For people who grew up with trauma, it's also very difficult for them sometimes to find safe relationships because for many of them, they've never really felt emotionally safe in their body, in their home, in their childhood. So even though those experiences were harmful, these are the experiences that they're familiar with, so they're naturally drawn towards unsafe people and unsafe relationships. So it's really important to put energy into building relationships with others that feel safe and that are built on providing each other emotional safety, because it's in that safety that the heart rate finds rest, that the immune system finds rest, that the hormonal system finds rest. It's really about bringing rest and giving our body time to replenish itself, which is what was missing in experiencing, trauma over an extended period of time without healing. And while everything that I just mentioned does not obviously erase the need for medical treatment if you're dealing with a chronic health condition, I do want to bring attention to the fact that there can be a great supportive role in helping you minimize the impact of the trauma on your health. Healing trauma and addressing childhood trauma doesn't just help you with your mental health. A lot of people think it's just like psychological, when, what science tells us that it's actually the overall body. It's your gut. It's your energy level. It's your mind, it's your emotions, it's your immune system. So healing your trauma literally heals your overall health. Trauma is obviously invisible, but it definitely has a huge impact on your life. If you're living with chronic disease and you've ever wondered, like, why me? Why am I going through this? I want you to know that your pain is valid. You did not deserve what happened to you. None of this is your fault. However, it is your responsibility to heal from that pain so that your body is not trapped in the system of continuing to emotionally, physically, physiologically reliving it. Because that is the real hell, is putting your body through an experience that it's already survived without respite. Your pain is very real. You're not imagining it. Trauma has a very profound and long-lasting impact on the human body. It's okay for you to recognize your sensitivity to certain things in your present life due to the traumatic experiences that you've had before. And the goal is to craft a life that invites more safe experiences to help your body feel at ease. If this content resonated with you, drop a comment in the box below. Let me know what has been your personal connection between trauma and your physical health, or have you seen any connections whatsoever? But I personally know that my trauma is connected to my psychological and emotional functioning. So in the later part of my life, I've really dedicated energy to healing because it's really important to me that I live a healthy life. Don't forget to like, subscribe, and share this video with someone who you think might enjoy this conversation around trauma and physical health. Until next time, be kind with yourself, be gentle with yourself, be vulnerable with yourself, give yourself compassion. Healing is not linear. It takes a long time to heal, but I promise you that journey is worth it. It's worth it 1,000,000 times over. Thank you so much for watching. I'll catch you on the next video from Styled Under Virgo about health and wellness. Au revoir! You can book your astrology reading at intuitivehealing.com. You can also watch videos at Intuitive Healing here on YouTube for Astrology 101 content. Listen to the Aquarius podcast on Spotify, as well as here on YouTube for your horoscope. If you're interested in astrology and love connections, you can visit at Styled Under Libra. And of course, for health and wellness and holistic healing, visit at Styled Under Virgo for all of your astrology content. Thanks so much for watching.